Hi guys, and welcome back to Spoony Life Lover. So as you can tell by the title of this video, this is my HS video, or my Hidradenitis suppurativa video, which, as many of you know, if you're long time followers of mine or subscribers, that is the skin condition that I suffer from and have suffered from a very long time. I will put it across the screen for you, and it will also be in the description box if you decide to go and do a bit of research on it. So I've decided to make a video all about HS, purely because I've just had surgery on a flare-up of mine, and some people asked me to make a video all about HS, so that's what I'm doing. If you stumbled across this video because you have HS, first of all, really sorry, I feel your pain. Secondly, welcome. Please hit the subscribe button if you are interested in sticking around. And two, if you haven't got HS but you just are interested and you are a long time subscriber of mine, then thank you for clicking on this video. The more we can spread awareness about this absolutely horrific skin disease, the better. So whatever your reason for stopping by, thank you for watching. So I've made a few little notes in my video notebook about HS. So first of all, most of this information is either knowledge that I've gained from me having HS, or it's off the NHS HS website. So I will leave the NHS website for HS. If I can, I will link it in the description box, but I'm not very good at things like this. I'm still very new to this game. And I will also link the if I can, the HS Trust website. If you are in the UK, I will highly recommend that you visit the HS Trust's website. It's got lots of useful information. There's phone numbers on there. It's really helpful if you are a HS sufferer. So if I can work out how to do it, I will link both of those websites in the description box below. So, HS is a painful long-term skin condition that causes abscesses and scarring to the skin. Now, these abscesses and scarring mainly affect sweaty, hairy areas. So we are talking axilla, armpits, groin, buttocks, breasts, anywhere that gets sweaty and that is particularly hairy. So not very nice places, but it's still important that we talk about this. Really important. It's not very nice to look at. If you Google some pictures of HS, you will see that it's not very nice to look at. And it's really wrong, because sufferers are made to feel embarrassed by their condition, and we shouldn't. We shouldn't be made to feel embarrassed. It's not our fault. There are 3 stages of HS: stage 1, stage 2 and stage 3. I'm stage 2, but there are 3 stages. And they go from obviously different severity, stage 1 being the mildest, stage 3 being the most severe. The exact cause of HS is unknown. We don't know what causes it. There is no definitive, that's what causes it, that little gene there or that little bit of thing causes it. But it does occur near hair follicles and sweat glands, so hence why it affects armpits, groin, which are 2 main hairy areas, and sweaty areas, so under your breasts, buttocks, anywhere that gets sweaty and hairy, basically. We don't know why, and this is something that it could be caused linked to hormones. We don't know why, but it does affect more women than men. Every time I go to my HS clinic in London, which is in Guy's Hospital, which is St John's Institute of Dermatology, there is always more women there than there are men. There are men there, don't get me wrong, but there's more women sitting there than there is men. So we don't know why that is, but it just affects more women than it does men. Symptoms range from mild, as I've said, to really severe, causing red-like boil symptoms. So if you've ever had a boil and you know how painful a boil is, this is what HS is like. Lumps, blackheads, cysts, scarrings and channels under the skin that leak pus. That is a description of what HS is like. So it's not a very nice disease. I have heard HS sufferers call it the hidden plague. If you've ever heard of the plague of London, it was a disease that caused red pus filled boils all over people, and we didn't know why. That's why some sufferers called it the hidden plague. I can quite see why they call it, some sufferers call it that. It is one of the most painful skin conditions around. It is extremely painful. If you've ever had an abscess, if you've ever had a boil, you all know it's very, very painful. But these are a lot more severe than just a normal abscess or a boil, and the scarring under the skin, the channels, they can all link together and fill with pus and need extreme surgery to cut away all the sweat glands, to cut away all the scarring, to cut away all the channels. And then in some very severe cases, HS sufferers do end up needing complete removal of the sweat glands, and they do need skin grafts to stop the reoccurring of the HS, and that is one of the last resort treatments for sufferers. So you can imagine how horrifically painful this disease really is. Yeah, it is extremely horrific. It really is. Causes unknown. Like I've said, we don't really know the causing of this disease. It is thought to be we don't know, but smoking and obesity strongly associates with HS. So if you have got HS and you're smoking, I highly recommend that you stop, because it will exacerbate your skin condition. It will make it worse. And also, if you're overweight, I'm overweight, but I used to be a hell of a lot bigger than what I was, and when I was a lot bigger, my skin condition was a lot worse than what it is now. I mean, I've lost 9 stone, and it was a lot worse when I was 9 stone heavier. So yeah, if you are carrying any extra weight, it is advisable that you can get that off. So yeah, smoking and obesity is 2 of the main causes that make HS worse. HS usually starts around puberty, so anywhere between 11 onwards, and it is also an autoimmune disease, so it is closely linked to diseases like Crohn's. Yeah, so I didn't know that until recently. Probably learned that about 2 years ago, and that I found quite, I didn't learn that until I went to this special hospital at Guy's, and that I found really fascinating to learn that it was down to your immune system as well. So, or it was, a link was found between the immune system and HS, which I found fascinating. But I'll come on to a treatment that I'm on for that in a second. HS also runs in families. In about a third of all cases. Now, my mum has HS, but my mum has it very, very mildly. I have it quite bad compared to my mum. It is not infectious. You will not catch HS from using a toilet after someone that has HS, from cuddling someone that has HS, from being around someone that has HS, from being friends with someone that has HS, from sharing a shower with someone that has HS, from going swimming with someone that has HS. It is not infectious. Okay, you will not catch HS. I just want to make that clear. You will not catch it. It is not infectious. Please don't ever think that. And also, it is not linked to poor hygiene. People with HS are not dirty. In fact, we are the total opposite. We are super, super clean because we are paranoid that we smell. We are, let's be honest, if we have wounds that are leaking pus, we are going to be extra vigilant about our personal hygiene, because we are going to be thinking that wound smells, that wound smells, that wound smells. Even though it is covered with dressings, it is probably going to be packed with packing, and it is going to be dressed daily by a healthcare professional. We are going to be shit hot on our personal hygiene in 99% of cases. So please do not get in your head, well, people with HS are dirty and that's why they've got this. It's nothing to do with personal hygiene. Okay, absolutely nothing to do with personal hygiene. It is purely because our body is a little bit fucked in the head. It is absolutely nothing to do with personal hygiene or anything like that, and it is definitely not infectious. Just like you can't catch HIV from using a toilet after someone, you cannot catch HS. My advice to someone is, if you're watching this video and any of the symptoms that I've talked about, so you're getting lumps in your inner thighs, your groin, your armpits, they're painful, they're leaking, they're pussy, they're red, you need to go and speak to your doctor. Early detection of HS is really important. I suffered with symptoms for about 10 years before I was diagnosed. And I was just thrown antibiotics after antibiotic. That's not the answer. You need to go and speak to your GP, and you need to tell them. I would highly recommend when you go and see your GP, you print out the NHS website's page for HS, and you go and you highlight the symptoms that you are experiencing, and you go and see your GP and you explain to them, I'm worried that I have this condition. These are the symptoms I'm experiencing. I've had them for this long, blah, blah, blah. I'm worried. I think I need to see a dermatologist. Dermatology referral is crucial for HS. Your GP does not know enough about HS. Unless they specialise in dermatology, it is not enough. Do not let them throw just antibiotics at you and send you on your way. It is not the answer. You need to see a dermatologist. You need to see that dermatologist, because there is specialist antibiotics that your dermatologist will want you to try. There are specialist creams, there is specialist topical treatments that your dermatologist will want to put you on, that your GP will, no offence to a GP, will know nothing about. So it's really important that you go to your GP and say, I think I've got this disease and I really need to see a dermatologist. Your GP will try and fob you off, but you need to stick to your guns, because I spent so many years back and forth to my GP, and I wish to God now that I'd been firmer and said no quicker than what I did. So I can't emphasize that point enough. So treatments for HS. I have been on so many treatments for HS. I have been on various antibiotics, creams, tablets for acne. I have been on tablets that are specialised for HS. None of them worked for me. There is not that many treatments out there for HS because it is quite a rare disease. The treatment that I'm on at the moment is this, which is called Humira. This is a immunosuppressant. I've been on this for coming up, well, it'll be 2 years in October, so about 18 months. No, 16 months, about 16 months. This has changed my life with regards to my HS. It is a injection pen. I administer this once a week. I was actually meant to give this to myself last night, but my alarm went off. I dismissed it because I was on my phone. then I forgot to get off my butt and get one out the fridge. So I'm waiting for a delivery of these today. They come sealed in this pack, and let me get it out for you. So they come hygienically sealed. I'm going to give this to myself after this video. So you've got part 1 and you've got part 2. Part 1 is where the needle is inside that bit. I don't know how to show you that bit. You never see the needle, don't ever see that bit. Part 2 is the stopper. So you put part 1 against your skin and you push part 2, and that is how you give yourself Humira. But your nurse and that, if you do end up going on Humira, will show you how to do that. I'm not going to go into that because it's down to your healthcare provider to do all of that. I give this to myself once a week, and it's completely eradicated 99% of all my flares. It is amazing. The only side effect I get, the very, very odd headache. That's it. Obviously you are immunosuppressed on this, so you do need to be careful with, with your immune system. So you need to take care when you're around people that are ill. You need to take care with hand washing before eating, antibacterial hand gel. Hand eye hygiene needs to be extremely important. If you're seeing friends, you need to ask them if they're well, because if they've been throwing up the night before and got diarrhea, you can't see your friend, because if you get diarrhea and sickness with this, you can be really ill. If you get pneumonia with this, you can be really ill. There's precautions before you go on this. Your dermatologist will want you to have a flu jab, a pneumonia jab, and if you're old enough, a smear test. They are, and you're female, they are they're the 3 things that my dermatologist wanted me to have before I commenced Humira. And yeah, it's potent stuff, but it's worked for me. I've just had surgery on a flare that kept coming up and up and up and up, and this time it came up with a vengeance. It was an 8-centimetre abscess, and I agreed to have it drained after IV antibiotics didn't work. So I am at the moment packing and dressing an open wound, but I'm still allowed to commence my Humira as long as the wound is not infected, which it's not. So that will be given to me after this video because I forgot last night. So like I say, I'm waiting in today for a delivery of those. They come privately, via the NHS. It all gets done separately, and I get 8 injections, and I get a sharps bin, and they must be stored in the fridge. So this box is my supply of dressings, packing and wound care. So I'm not going to go through everything, but I'm just going to show you a few things that I'm using at the moment to take care of my skin, because I obviously have an open wound. So these are called dressets. These are a sealed, sterilised dressing pack, which has got gloves in it, a sterilised bag, it's got gauze in it, it's got an apron in it, it's got a ruler in it to measure the wound. It's just all sterile. For my mum does my dressings, which she's been trained by a medical professional, because at one point I was having so many incision and drainages my local surgery couldn't fit me in to do them. So my mum is trained to do my dressings, and she very kindly does them for me. So this is what we use to do my dressing, and it's all sterile. So just lay one of these out and all the rubbish goes in the bag, and it's just got the gauze and everything we need to clean the wound and throw everything in the bin basically, and sterile gloves. So they come in a bag, looks like a bit of a, you know, a cool bag that you would take your sandwiches out in on a picnic. So we have those. Not everyone will have those. That is a personal choice. These are the dressings that I favour. So the Meplex Borderlight, I have two sizes. I have the 10 by 10.5 and I have the 7.5 by 7.5. I'm favouring the larger ones at the moment, purely because I have a large wound at the moment, but they are both brilliant. The reason I like these dressings is because they are very soft. They are almost made of silicone, like they're very bendable, and they don't pull or rip my skin off with the dressing, because my skin is very thin because I've had a lot of surgery. It doesn't pull the skin with the dressing. So these for me are essential. They come in all different sizes, and they come in obviously a sterile sealed pack, and they come in boxes of 10. So they are a must for me. The next thing that's a must for me is this, which is Cavalon No Sting Barrier Film Spray. So it's a pump spray that you spray around the edge of the wound. Just pump it around the skin, and it stops the skin from getting sore around the dressing site. That's a must. Another must is Aquacel. This is packing. This goes inside the wound. So it goes inside the wound like, I don't know if it's focusing, yeah, like that. So concertina's up inside an open wound to suck up all the gunk, because with abscesses and things that they drain, they don't stitch. You end up with an open wound. So these are a must. Again, they come in sealed sterilised packets. They are amazing. And last but not least, the last thing I'm going to show you is Instilogel. If you have HS, coming in real close now, you need this in your life. Do not attempt to have a wound packed without Instilogel, because this is lignocaine. It is local anaesthetic gel, which you can squirt in the wound. It will sting like a bitch for about 30 seconds, but then it completely numbs it. So do not attempt to have a wound packed. Ask for Instilogel. At your hospital, at your surgery, you need Instilogel. If you take one thing away from this video, this needs to be your new best friend. Okay? You can rub it around wounds, you can rub it on abscesses, and it will stop it hurting for a while. These need to be your best friend. They come in syringes. This one's been used, so this needs to go in the bin, but it will come up to here. They come with a stopper on the end, no needle, just a stopper on the end. They come in sterilised packets. Let me get a new one out for you. They come in sterilised packets like that. You need Instilogel in your life if you have HS. Now I've discovered this, refuse to have a dressing change without it. So that you need that in your life. So guys, I think that's it. Yep, it does take up a lot of space having HS. Obviously I have to store all of this. I have to find somewhere to store all of this, and it's messy, it's a pain in the arse. But there's people out there that have to have feeding tubes, that have to have formula milk, that have to, you know, I'm not complaining. So if you have any questions that I have not covered in this video, do not be afraid to leave them in the comments box. I will get back to you. If I can't answer them, then I'm sorry. But if I can't answer them, probably Google can, or a doctor will be able to answer them for you. But most of the time I can answer them. I've had HS for coming up 19 years, so there's not a lot I don't know about it. So I hope you've enjoyed this video. I hope it's given you a little bit of insight into what it's like to live with HS. And yes, it's a bitch, but there's worse things to live with out there, a lot worse. So I'm not complaining. One last thing I just want to mention, most of my HS is in my groin. I've had one in my armpit in the whole time that I've had HS. I get some of my breasts, but most of it is my groin. So I'm very lucky because I can cover my HS up in the summer. I obviously don't walk around without underwear and shorts and t-shirt or trousers on. So I'm lucky in that respect. But yeah, so if you have any more questions and anything I've missed out, please do comment down below. If you want more information on HS, check out the HS Trust's website. Like I say, I'll try and link that and the NHS website in the description box for you. As always, my social media will be in the description box. If you enjoyed this video, please give it a thumbs up. Please subscribe if you're not already. Turn your bell on if you want to be notified when I upload. And as always, guys, thank you so much for watching, and I will see you very soon with another video on Spoony Life Lover. Thank you so much for watching, guys, and I will see you very soon. Take care.